Hello everyone, now let us discuss about CPT coding guidelines for radiology part 9b. In the current session, we will be discussing about the second part of nuclear medicine. As we have discussed earlier, nuclear medicine is mainly of two types, diagnostic and therapeutic. In this current session, we will be discussing remaining topics under diagnostic and we will be covering the therapeutic nuclear medicine, CPTs. So the topics that we are going to cover under diagnostic nuclear medicine are cardiovascular system, respiratory system, nervous system, Gentry urinary system and other procedures. Now coming to cardiovascular system, the myocardial perfusion scans, which are nothing but SPECT and PET scans. SPECT is nothing but single photon emission computed tomography. Single photon emission computed tomography, whereas PET is nothing but positron emission tomography. The myocardial perfusion scans and the cardiac blood pool imaging studies, they can be performed either at rest or during stress, or they can be combinedly used at rest and at stress. So whenever they are performed during exercise or pharmacologically induced stress, appropriate stress test codes from the series 93015 to 93018 series may be reported in addition to these myocardial perfusion scans, which come under these codes. And similarly, a PET can be performed on either a dedicated PET machine, which uses a PET source for attenuation correction, or a combination of PET and CT camera, as we will see in this following code description: 78429, 78430, 78431 and 78433. And this cardiac PET study performed on a PET/CT camera includes the examination of CT transmission images for review of anatomy. So additionally, chromatography transmission guidance need not be coded. Whenever a PET scan is performed using a PET/CT camera. Now coming to various CPTs of cardiovascular system, the first CPT is 78414. It deals with determination of central hemodynamics, non-imaging. Determination of central cardiovascular hemodynamics, non-imaging. For example, ejection fraction with probe technique, with or without pharmacological intervention or exercise, single or multiple determination. The next code is 78428. It deals with cardiac shunt detection. And the next code should be 78429, but it is given out of sequence with another series. So first we will be discussing about 78445. The description is non-cardiac vascular flow imaging, for example angiography and venography. The non-cardiac vascular flow imaging, you need to report 78445. The next CPT is 78451. This is nothing but myocardial perfusion imaging tomographic. Myocardial perfusion scan, which is nothing but SPECT scan, which includes attenuation correction, qualitative or quantitative wall motion, ejection fraction by first pass or gated technique, additional quantification whenever performed, single study at rest or stress. The next CPT is 78452. This is a continuation. The description is nothing but myocardial perfusion imaging, SPECT, but multiple studies. This is a myocardial perfusion imaging SPECT scan, but previous CPT, that is 78451, was limited for single study, whereas whenever multiple studies are done, you need to report 78452 at rest or at stress and or redistribution and or rest re-injection. Coming to the next CPT, that is 78453. It deals with myocardial perfusion imaging planar. Single study at rest or stress. Stress can be exercise or pharmacologically induced stress. The next CPT is 78454. It deals with myocardial perfusion imaging planar, multiple studies. Previously it was 78453 deals with single study, whereas 78454 deals with myocardial perfusion imaging planar, multiple studies at rest or stress and or redistribution and or re-injection. The next CPT is 78456. It deals with acute venous thrombosis imaging peptide. The next is 78457. It deals with venous thrombosis imaging venogram unilateral. The next is 78458. It deals with venous thrombosis imaging venogram bilateral. The next is 78459. It deals with myocardial imaging, positron emission tomography, PET, metabolic evaluation study, single study. So myocardial imaging using PET scan, the CPT is 78459 for single study. The next CPT is 78429. This is an out of numerical sequence CPT, hence it is indicated by a number sign. 78429, it deals with myocardial imaging, positron emission tomography. That is nothing but myocardial imaging using PET scan with concurrently acquired computed tomography transmission scan. So, for reporting PET/CT scan, for reporting myocardial imaging using PET and CT scan, both you need to report 78429. The next CPT is 78466. It deals with myocardial imaging, infrared, avid, planar, qualitative or quantitative. The next CPT is 78468. It deals with myocardial imaging, infrared, avid, with ejection fracture, first pass technique. The next CPT is 78469. It deals with myocardial imaging, infrared, avid, using tomographic, that is nothing but SPECT, with or without quantification. The next CPT is 78472. It deals with cardiac blood pool imaging, gated equilibrium, planar single study at rest or stress, wall motion study plus ejection fraction with or without additional quantitative processing. Cardiac blood pooling imaging, gated equilibrium, planar single study at rest or stress is given by 78472. The next CPT is 78473. It is nothing but cardiac blood pool imaging, gated equilibrium, multiple studies, wall motion study plus ejection fraction with or without additional quantification. The next CPT is 78481. It deals with cardiac blood pool imaging, for first pass technique, single study at rest or with stress, wall motion study plus ejection fraction with or without quantification. Cardiac blood pooling with first pass technique is given by 78481. Whereas cardiac blood pooling with gated equilibrium is given by, single study is given by 78472, whereas multiple studies it is given by 78473. The next CPT is 78483. It deals with cardiac blood pool imaging, planar first pass technique, multiple studies at rest and with stress, wall motion study plus ejection fraction with or without quantification. The next CPT is 78491. It deals with myocardial imaging using PET, which is nothing but positron emission tomography perfusion study, single study at rest or stress. The next CPT is 78430. This is also an out of sequence CPT, hence it is given or indicated by a number sign. The description is myocardial imaging PET perfusion study, single study at rest or stress with concurrently acquired CT tomography transmission scan. So this is only PET scan, whereas 78430 is nothing but PET/CT scan. Myocardial imaging single study. Both are single study. For when only PET is used, PET scan is used for single study, you need to quote 78491. Whereas when both PET/CT camera is used, for single study, you need to quote 78430. The next CPT is 78492, which is nothing but myocardial imaging, positron emission tomography, multiple sites at rest or stress. Whereas the next CPT is, this is also an out of sequence CPT, 78431. This deals with myocardial imaging, positron emission tomography perfusion study, multiple sites at rest and stress with concurrently acquired CT tomography transmission scan. In the previous slide, we have discussed about single study, PET and CT scan. Here we are discussing about multiple studies. For multiple studies, when only PET scan is used, you need to report 78492. Whereas for multiple studies, when PET along with CT camera is used, you need to report 78431. The next CPT is 78432. It deals with myocardial imaging, positron emission tomography, combined perfusion with metabolic evaluation study. Now coming to the next CPT, that is 78433. This is an out of numerical sequence CPT, hence it is indicated by number sign. The description is myocardial imaging, positron emission tomography, which is nothing but PET, combined with PET scan, combined perfusion with metabolic evaluation, single study, concurrently acquired CT, computed tomography transmission scan, which is nothing but PET plus CT scan. One more important point is here, perfusion and metabolic evaluation are combined. Coming to next CPT, it is an add-on code plus 8434 plus 78434. The description is absolute quantitation of myocardial blood flow, AQMBF, positron emission tomography, rest and pharmacological stress. The code 78434 should be used in conjunction with 78431 and 78492. There will be a bit of confusion regarding the codes with only PET and CT combined codes. For that purpose, let us discuss a flow chart. Coming to next CPT 78494. The description is cardiac blood pool imaging, gated equilibrium, SPECT, which is nothing but single photon emission computed tomography at rest, wall motion study plus ejection fraction with or without quantitative processing. The next is an add-on code plus 78496. It deals with cardiac blood pool imaging, gated equilibrium, single study at rest with ventricular ejection fraction by first pass technique. Whenever ventricular ejection fraction by first pass technique is added, this CPT must be reported. Use plus 78496 CPT in conjunction with 78472. The next is unlisted cardiovascular procedure diagnostic nuclear medicine. The CPT is 78499. So for better understanding, let us focus only on myocardial imaging. So myocardial imaging is broadly categorized based on the type of evaluation as metabolic evaluation, perfusion evaluation, combined metabolic and perfusion evaluation. Let us discuss some CPTs regarding it. The metabolic evaluation is again subcategorized into single study. Whenever PET metabolic evaluation single study is done, myocardial imaging using PET metabolic evaluation single study, the CPT is 78459. And similarly, when myocardial imaging is done using PET plus CT scan, metabolic evaluation single study, the CPT is 78429. Now coming to myocardial imaging via perfusion evaluation. It is again divided into single study and multiple study. So whenever myocardial imaging is done using PET scan via perfusion study or perfusion evaluation single study, the CPT is 78491. And similarly, when PET scan is combined with CT camera via perfusion evaluation single study, the CPT is 78430. And when myocardial imaging is done via PET scan perfusion evaluation multiple study, the CPT is 78492. And similarly, when PET scan is combined with CT camera perfusion evaluation study multiple study, the CPT is 78431. Now coming to combined, whenever myocardial imaging is done using combined metabolic and perfusion evaluation. When PET is used for myocardial imaging with combined perfusion and metabolic study, the CPT is 78432. And similarly, when PET plus CT scan is used for combined perfusion and metabolic study, the CPT is 78433. These are some of the CPTs for PET scan and PET scan along with CT imaging. Now let us discuss an example. A patient presents to hospital for cardiovascular SPE-CT study. A single study is performed under stress but without quantification with a wall motion study and ejection fraction. Select the CPT for this purpose. Here, cardiovascular SPE-CT study is done and the study is single study and it is performed under stress. The appropriate CPT is 78451. Myocardial perfusion imaging tomographic, which is nothing but SPE-CT, including attenuation correction, qualitative or quantitative wall motion, steady ejection fraction by first pass or gated technique, additional quantification when performed, single study at rest or stress. So this is done under stress and quantification is not done, and this is a single study. So the appropriate CPT is 78451 for this particular scenario. Now coming to the nuclear medicine codes for respiratory system. The first CPT is 78579. The description is pulmonary ventilation imaging, example aerosol or gas. The next is 78580. Pulmonary perfusion imaging via particulate. And the next is 78582. Pulmonary ventilation, example aerosol or gas and perfusion imaging. 78597. The description is quantitative differential pulmonary perfusion, including imaging when performed. Now coming to next CPT 78598. Quantitative differential pulmonary perfusion and ventilation, including imaging when performed. The next is unlisted respiratory procedure, diagnostic nuclear medicine. The CPT is 78599. Let us discuss an example. A patient presents with pulmonary embolus and a ventilation perfusion lung scintigraphy is performed using macro-aggregated albumin particles labeled with technetium 99M. So what are the appropriate CPTs for this scenario? The appropriate CPT is 78580, which is nothing but pulmonary perfusion imaging, example particulate. And additionally, HCPCS code for macro-aggregated albumin particles must be assigned. A9540, which is nothing but technetium TC99 macro-aggregated albumin. Now coming to the nuclear medicine codes for nervous system, the first CPT is 78600, which is nothing but brain imaging less than 4 static views. The next is 78601, which is brain imaging with vacuolar flow, less than 4 static views with vacuolar flow. The next is 78605, brain imaging minimum 4 static views. The first CPT 78600 is brain imaging less than 4 static views, whereas 78605 indicates brain imaging minimum 4 static views. The next is 78606, brain imaging minimum 4 static views with vascular flow. Now coming to next CPT 78608, which is nothing but brain imaging positron emission tomography PET metabolic evaluation. The next CPT is 78609. It is nothing but brain imaging PET perfusion evaluation. The next is 78610, brain imaging vascular flow only. The next is 78630, cerebrospinal fluid flow imaging cysternography. Now coming to next CPT 78635, which is nothing but cerebrospinal fluid imaging ventriculography. The next is 78645, which is nothing but cerebrospinal fluid flow imaging shunt evaluation. The next is 78650, cerebrospinal fluid leakage detection and localization. The next is 78660, which is nothing but radiopharmaceutical dacryocystography. The next is 78699, which is nothing but unlisted nervous system procedure, diagnostic nuclear medicine. By this we complete the nuclear medicine CPTs for nervous system. Now coming to nuclear medicine CPTs for Gentry urinary system. The first CPT is 78700, kidney imaging morphology. The next is 78701, kidney image morphology with vascular flow. The next is 78707, kidney imaging morphology with vascular flow and function, single study without pharmacological intervention. The next is 78708, kidney imaging morphology with vascular flow and function, single study with pharmacological intervention. The next CPT is 78709. It deals with kidney imaging morphology with vascular flow and function, multiple studies with or without pharmacological intervention. The next CPT is 78725. Kidney functional study, non-imaging radioisotopic study. The next is an add-on code plus 78730, which is nothing but urinary bladder residual study. The next is 78740. It is nothing but urethral reflex study. The add-on code 78730. It must be used in conjunction with 78740. The next CPT is 78761, which is nothing but testicular imaging with vascular flow. The next is the unlisted Gentry urinary procedure, diagnostic nuclear medicine. The CPT is 78799. Now coming to other procedures in the nuclear medicine. The first CPT is 78800. The description is radiopharmaceutical localization of tumor, inflammatory process or distribution of radiopharmaceutical agent, planar, single area, single day imaging. The next CPT is 78801. It deals with radiopharmaceutical localization of tumor, inflammatory process or distribution of radiopharmaceutical agent, planar, 2 or more areas, 1 or more days imaging or single area imaging over 2 or more days. The first CPT is single area, single day imaging. The second CPT, that is 78801, it deals with 2 or more areas or 1 or more days imaging or single area imaging over 2 or more days. The next CPT is 78802. It deals with radiopharmaceutical localization of tumor, inflammatory process or distribution of radiopharmaceutical agent, planar, whole body, single day imaging. This is also an out of sequence code, hence it is indicated by number sign. The description is radiopharmaceutical localization of tumor, inflammatory process or distribution of radiopharmaceutical agent, tomographic, SPECT with concurrently acquired CT transmission scan for anatomical review, localization and determination, detection of pathology, single area, single day imaging. The next CPT is 78831, radiopharmaceutical localization of tumor, inflammatory process or distribution of radiopharmaceutical agent, tomographic SPECT scan, minimum 2 areas, single day imaging or single area imaging over 2 or more days. The next CPT is 78832. It also deals with radiopharmaceutical localization of tumor, inflammatory process or distribution of radiopharmaceutical agent, but SPECT, tomographic study with concurrently acquired CT transmission scan for anatomical review, localization, determination or detection of pathology, minimum 2 areas, single day imaging or single area imaging over 2 or more days. The next is an add-on code plus 8835 plus 78835. It deals with radiopharmaceutical quantification measurement, single area. Use plus 78835 in conjunction with 78830 or 78832. The other procedures are 78808. Injection procedure for radiopharmaceutical localization by non-imaging probe study, intravenous. For example, parathyroid adenoma. The next is 78811, positron emission tomography imaging, limited area. The next is 78812, positron emission tomography imaging, skull base to mid-thigh. The next is 78813, positron emission tomography imaging, whole body. The next is 78814, PET with concurrently acquired CT for attenuation correction and anatomical localization imaging, limited area. And 78815 is nothing but PET with CT, skull base to mid-thigh. Next is 78816 is nothing but PET with CT, whole body. Next is 78999, which is unlisted miscellaneous procedure, diagnostic nuclear medicine. By this we complete the entire codes for nuclear medicine, diagnostic part. Now let us discuss the therapeutic part. Now coming to nuclear medicine, therapeutic part. When we are coding therapeutic nuclear medicine, oral and intravenous administration codes are inclusive of the mode of administration. That there are no specific codes for these, oral or intravenous. But for intra-arterial, intracavitary, intra-articular administration, appropriate injection or procedure codes, as well as image guidance and radiological supervision and interpretation codes need to be coded whenever applicable. This is important point. Whenever we are coding therapeutic nuclear medicine, oral and intravenous administration codes are inclusive of the mode of administration. But whenever procedures are done using intraarterial, intracavitary or intraarticular administration, appropriate injection codes, procedure codes, as well as image guidance and radiological supervision and interpretation codes need to be coded whenever applicable. Now coming to the CPTs for therapeutic nuclear medicine. The first CPT is 79005. It deals with radiopharmaceutical therapy by oral administration. The next is 79101. It deals with radiopharmaceutical therapy by intravenous administration. The next is 79200. It deals with radiopharmaceutical therapy by intracavitary administration. Here additional codes are required. Next is 79300. It deals with radiopharmaceutical therapy by interstitial radioactive colloid administration. The next is 79403. It deals with radiopharmaceutical therapy, radio-labeled monoclonal antibody by intravenous infusion. The next is 79440. It deals with radiopharmaceutical therapy by intraarticular administration. The next is 79445, deals with radiopharmaceutical therapy by intraarterial particulate administration. The next is 799999. It deals with radiopharmaceutical therapy unlisted procedure. Now let us discuss an example. A patient with thickening of synovial membrane undergoes a fluoroscopic guided radiopharmaceutical therapy joint injection. This is a joint injection on his right knee without ultrasound. What CPT codes are to be reported by physician if performed in an ASC setting? The first CPT must be 79400, which is nothing but radiopharmaceutical therapy by intraarticular administration. Because it is a joint injection, it is intraarticular administration. The next code is 20610. Orthosynthesis aspiration, that is injection to major joint or bursa. Because this is a joint injection, you need to code this CPT 20610. Orthosynthesis aspiration and or injection major joint or bursa, for example shoulder, hip, knee, subacromial bursa. And next is, it is done under fluoroscopic guidance, hence 77002. Fluoroscopic guidance for needle placement must also be coded. Additionally, 26 modifier must be appended to indicate the professional component. By this we complete the entire nuclear medicine topic of radiology. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.